So one of the things we see a lot and say a lot around here is, I don't care what your back looks like, I care what it feels like, right? So everybody will tell you that you have a herniation or you have a bulging disc, and that's the root of your pain. Now, you may have done chiropractic and physical therapy to no effect, pain management to no effect, and you may have done a surgery to no effect. And of course, to a hammer, everything's a nail, so a surgeon's going to operate. But if you're coming to us with your MRI reports and you're telling us that you have a herniated disc, it's almost like a plant in your mind that that's the root cause, and it's not really the bulk of it, right? So it's usually something muscular. So because if you've done all this stuff, you've done the surgery, you've done the PT, you've done the chiropractic, everybody's telling you it's coming from the herniations, the vertebra, and stuff like that. Well, guess what? If you come to us, the last stop, it's not that. And usually what it is, it's the muscles, right? It's the lower back. The same thing could be said about me. People say, oh, I got bone on bone, bone on bone. But if you've been told your whole life to walk for fitness, you have to think about you multiply your body weight times 3 every time you take a step normally. If you're pounding the boards, that's a lot of wear and tear. And I guarantee nobody along the line told you to stretch before you hit. And what happens is the quads, the hamstrings, and the calves all tie into the knee, and they cause some sort of tension. Now, nobody gets out of life unscathed. Even if you have a small tear on the tendon, if you go to activate those muscles that are tight around the joint, well, they're going to pull and they're going to hurt. You're going to feel a sharp stabbing going up and down the stairs. There's a reason for that. It's usually muscular, and that's where we say to the patient, I don't care what your back looks like, I care what it feels like. And if you had, think about it, if you had a herniation your whole life and you didn't have pain, would it really matter? Not really.
So where do you think this confusion comes from, where patients get that?
It's the narrative, right? It's like, you know, even your primary care physician is telling you it's coming from your back, it's coming from your back. They send you to pain management, they do an MRI. It's almost it's like the reverse of placebo, right? Like it's like, oh, I feel better. My doctor told me the right thing, or they gave me the right sugar pill, and I feel better. Now it's like a death sentence, right? Oh, I have a herniation, and that's the root cause of the pain. Usually not the case, because a lot of times, so I'd say 90% of the time, we treat it and you get better regardless of what your MRI looks like. And really what it is, it's the muscular portion of it.
Right. And that clearly relates to like what you're always talking about, the local, regional, and central effect, right? That it's not necessarily about what's happening in the local area in terms of like what the imaging shows. It's about the dynamic relationship of the muscles with the structures, and then how acupuncture overrides the wiring to kind of reset it back to a normal and healthy state.
If you're sitting at a desk for 8 hours, don't expect not to be uncomfortable, right? And it's not strenuous, you're not breaking rocks, but that compression of the lower back muscles over time, it's going to cause problems. There's a whole institute dedicated to that, you know, OSHA, worker harm reduction, accident prevention. I've said it before, it's not the construction accidents, the $1 million cases, it's the sitting at the desk, it's the shortening of the muscles, it's the compressing of the glutes that cause sciatica, and so on and so forth. And really the answer is, which nobody's going to do and nobody tells you, or they coerce you to, is stretching, right? When you go to a grocery store and you see the stretching charts, it's not asking you to take some time and take care of your body. It's saying we want to reduce liability of the corporation, so we want our workers to have a loose back before they start lifting. Lift with your legs, that whole storyline.
What are those stretching protocols like in terms of what they recommend for workers to do?
So a lot of it is, you know, the deep forward bends, it's the spinal twists. You know, it's really to loosen up the lumbar area for the heavy lifting, you know, when you lift. So one of the things that they don't explain to you is that muscles have a protective mechanism, right? So if you go to lift something and you lift something wrong, if the body believes there's receptors in the body that look at like positioning in time. So if they feel that the vertebra is going to shift out of position because you went to go lift the vacuum and you didn't bend your knees, if it feels that that weight is going to compromise the spinal cord, the muscles will leash into place, and next thing you know, you're in an ambulance to the hospital, right? Because you threw out your back so bad. That is a protective mechanism. But what happens is after it resolves naturally, it doesn't really kind of go away, and you have this residual 3 to 8 constant ache because you did something and the muscles are still kind of stuck in protection mode, and you're sitting at a desk for 8 hours, and you're not stretching before you go and work out. And it's almost like the perfect storm. It's constant
overuse, repetitive stress injury that is the bulk of all fitness and just lifestyle.
No, absolutely. You know, what I always think is interesting about what you're talking about in that mechanism is because it kind of primes the patient to kind of be misinformed, because
Yeah.
that happens,
Yeah.
and then they go to the hospital and they get the nice image that shows whatever the muscles clamping was trying to protect, right?
Right.
So it shows the disc, but the disc could have been, it's not the disc that's causing the pain at that moment. There are some
Right.
cases, right, when the disc actually goes on the
Yes.
nerve root. We're not saying that doesn't
Very
make it.
severe, very
Right.
severe.
However, I feel like where the confusion lies with the general patient population is they don't understand that what they're seeing on the image is not always the cause. It can actually be the response to that cause
Yeah.
that's causing the pain, which you actually see because some doctors will prescribe what? Muscle relaxers.
Right.
So they
Yeah.
know on some level, it's not just
Yeah.
the picture, right?
Mhm.
It's not just the stenosis, but it kind of gets swept under the rug. So when they come to us, right, that's when they feel it's shocking.
Yeah.
It's like, we don't care what it looks like, but if you actually look at it, it's already in the treatment course. They've been given muscle.
It's like a
relaxers.
sandwich. You can have the herniation, you can have a
Yeah.
bulging disc. If you have muscle spasm in parallel, wouldn't it make sense to relieve some of the spasm to take pressure off the nerve and get
Right.
relief that way? No, because to a hammer, everything's a nail. We're just saying, everybody does their own thing. If you want a cage in your back with screws
Yeah.
to get rid of your back pain, think about it, right? Our hammer in acupuncture is minimally invasive and non-pharmaceutical,
Right.
right? So before you get to the end of the
Yeah.
line and you call us, think about trying acupuncture first. If somebody tells you it's your back or it's coming from your back, please think about giving us a call and trying it out, because not only are we going to do the acupuncture and get the muscles to behave themselves, we will implement some sort of at-home care, the
Right.
stretching. That's a big part, because it's foolish to think that we could just treat it, it's gonna go away.
Yeah.
You have to implement some sort of course correction to avoid the sitting of the 8 hours or standing at a workstation. You know, the standing desks are supposed to be better, but what makes you think you're not gonna develop some sort of sciatica? Ask any barber how much they love standing, right? It's
Which is very interesting, like working here, because you're one of the few people that I see actually, you know, because acupuncture school, where they always say what? It's not just about what we do in the room, it's a lifestyle medicine,
yeah,
right?
absolutely.
And so, like, it's branded as such, but I feel like you're one of the few that I've seen actually prescribe
That didn't
those.
come right off the bat.
Right.
That I was a happy accident, because being the only son and the youngest cousin in the family business, you got the shit work, which was
Right.
safety, right? It's a thankless job, nobody wants to do anything. And one of the big things we learned in industrial hygiene is this importance of, like, you know, stretching, not sitting at a desk for 8 hours. That's why you do, I mean, the movie back in the 80s about Gung Ho, about the Japanese company that took over the American car factory, and the Japanese workers were out there working, stretching out. You'll see unions, a lot of the union bosses will say, why lead my crew with stretching? Why do they do that? Yes, it's part of like camaraderie and team building, but really at the end of the day, it's about keeping those muscles loose and pliable around the areas. Getting back to the knee thing, like, don't go, I mean, a knee surgery, a knee replacement's a pretty big deal. Try something conservative first, something like a few treatments with stretching can contribute to your overall health. But yeah, ironically, I didn't want to do it back then. I wasn't into it when I was doing it, but it was a necessity. And funny enough, it comes full circle. It's pretty applicable when we're dealing these.
Right.
And the same thing with the neck too. You can.
Yeah.
It's not the neck, it's the back, it's staring at a computer. You're taking an 8-pound, 10-pound bowling ball and putting on a stalk of celery and staring at a screen all day. You're gonna have neck problems.
Yeah.
So you have to stop, you have to stretch. And you're allowed, by the way. This is what OSHA does. Like, you're allowed for X amount of typing, 2-3 hours, whatever. You're supposed to take a 20-minute break to undo that.
Right.
You're sitting at a desk anyway, right? You got sciatica, back pain. What's hard about doing a seated pigeon? It's gonna go a long way. But sometimes it gets too acute, like we said, that injury response, that protective mechanism. There is a part where we have some responsibility, you know, the local twitch response when we're treating. We have to deactivate the muscle, but once it's deactivated, then you can kind of implement the stretching, which keeps it away long term.
Yeah, which is that little piece of nuance that I've noticed that you have, because I feel like by doing that work, it gave you that perspective. You're like, I never see that you're gonna rush to get a result. Like, you always want the result, but like, you understand that it's an iterative process, and these things kind of slowly evolve. So, you know, you kind of hold the patient accountable to that lifestyle change. That yes, you have to stretch at home. And I feel like you probably got that mindset from doing the classes that you learned even before acupuncture school. Like, no, to keep your body healthy, you have to do some work. It's not like you can just keep your body,
Exactly.
you know what I mean?
But I've had the back pain, I've had the sciatic, I've had the neck pain. I did the stretching, but I don't do it anymore because I'm not in pain. Will I need to at some point down the road? Of course.
Yeah.
But that's the nature of all things. We're very reactive as human beings, is that if we're okay and we're better, then we'll kind of lay off, and
Right.
that's when it kind of creeps back in.
Yeah. Which is kind of interesting to this point, because we often see that sometimes when that happens to a patient, or let's say their back hurt, they didn't come to us because they didn't need to, which is minor, but then it shifts their weight just a bit to now a couple months later, they forgot their back hurt a couple months ago and their knee hurts. And now the doctors come and say they have arthritis, but we know that actually if you look at where the pain is happening, sure, there might be arthritis, but that arthritis actually, that bone on bone, that
Yeah.
deterioration of lining could actually be the result of the muscular imbalance because they're compensating. And I feel so a lot of people will say that, oh, it's not gonna work because it's bone on bone, but they don't, because they don't understand the mechanism and the full range of how the body works, because they either haven't studied or done the industrial hygiene. It's like,
We need to differentiate the pain,
exactly.
because dull ache is usually something muscular, like the muscles ischemic, it's not getting
Yeah.
a good supply of blood, it shortens, it dries out,
Yeah.
it becomes short,
Right.
you go out of its range of motion, it gets a little achy. Sharp is always tendinous, right? It's like a hangnail. If you played sports, you maybe have like a small, and maybe a doctor will do an MRI and tell you it's completely inoperable, shoulder or knee or hip. But, when the muscles around it get tight, when you go outside of that, it will sort of nag on that hangnail and it'll be sharp. Burning is more neurological. That could be like a very sort of aberrant signal. That's probably a reason to have
Yeah.
a surgery, because of a full extruded sort of disc is
Yeah.
like all that gel is pushing out. And then numbness and tingling too. That's neurological, some sort of compression or blood flow to the musculature. But we talk about sciatica, it's this pain that goes all the way down the leg. It's not that your whole leg has a problem, it's that the glutes are so tight, they're clamping down, and because the sciatic nerve feeds the whole leg, you can feel it all the way down. Now, with sciatica, what happens, you can treat the whole leg, and it will get improved from the ankle up. That's when you know the root is the glute, but then it can kind of separate. You can have a calf problem, you can have an IT band issue, you can have a quad issue, you can have this, you can have all that. Doesn't mean we can't treat it, we just have to kind of pinpoint and work around it. But at the end of the day, it's usually a muscular issue. You can do all the chiro PT you want. We ask that you come see us after you get checked out, bring the MRI results, that's fine too. Oh, here's another thing too, by the way. Don't wait to have the MRI to start treating. You're wasting time. You could be getting better. By the time your insurance improves your MRI, we've probably resolved it.
Right.
The other thing, we gotta call it, I gotta see my doctor before I come and get acupuncture. Why? Do you just not wanna get better? Do you wanna feel pain? Yeah, get checked out. When's the next time you're gonna see your primary care physician? He's
Yeah.
booked up, right?
No,
You go to a treat and release, where they'll just give you an antibiotic just because, whatever your problem is. But get started, get early. You could be getting relief and get checked out.
Yeah.
I'm not saying don't go to your doctor, just don't wait to get better.
Yeah, I think it's, folks aren't understanding how we do things, so
Yeah.
they feel like it's a similar run-up, because, they just wanna get a picture taken, but then they have to do like, 6 weeks of PT before they get the script?
It is very dangerous to have that suggestion in your
Exactly.
head, because
I
once
know.
you see, and that's why I say, getting back full circle, I don't care what your back
Yeah.
looks like, I
Yeah.
care what it feels like.
Yeah.
Only the patient knows. You know if you're better, you
Yeah.
know if the pain's gone away. Don't make the MRI or the herniation the root cause, because there's a lot of reasons. On the back end, I know a lot of orthopedic surgeons, they would say 90% of all herniations are inoperable.
Yeah.
So really, what is it? Do I have to make my quota? Do I have to pay my golf membership? How many back surgeries do I gotta turn around? Or the hospital,
Yeah.
special surgery, we've done 1 trillion surgeries. Did you need to do all those surgeries?
Yeah.
No?
I mean, I know personally speaking from my experience, like, it changed my perspective when I realized that I was treating just as many people who had surgery as who didn't.
Right.
If surgery was the be all end all, now granted, somebody can make the argument, sample size, you're only gonna see people in pain. But it just goes to show you that it's like some of these people who are being sold that, oh yeah, you'll be
Mhm.
fine, right?
Yeah.
They go through the surgery, they go through the rehab, which is pretty long and intensive, by the way.
Yeah.
Only to eventually wind up at the same place. Where they
Right.
could have used all that time to make the changes.
You've said it yourself. If you're worried about needles, quote unquote, which we don't use here, we use filaments.
Yeah.
Think about getting sliced open with a knife. Just because you're under doesn't mean it's not doing damage. And then do you want like a steel cage in your back?
Yeah.
with bolts that are like literally the size of my finger screwed into your spine. I've seen them. I've seen the X-ray. I've seen the MRI.
I was gonna say, do yourself a favor, if you or anybody in your family is going to do any kind of surgery, I'm not telling you whether to get it or not, I'm just gonna tell them, look up an X-ray, two things, look up an X-ray of what is actually being done, and two, go around and canvas people who've actually had it done, like 5-10 years out, to see how they feel. Don't just listen to the surgeon, please listen to your doctors, but also get second opinions.
Yeah.
Because I found in my experience, sometimes people feel that they've been sold a bill of goods, right? And I don't meet these people on the street, I meet them when they're coming to get relief from the pain that the surgery was supposed to get away from.
Yeah, it's an opinion, right? We all have an opinion. Ours is based on 20 years of clinical experience. It's minimally invasive and non-pharmaceutical. You know, getting a surgery is also another opinion. But get 2, 3. We don't know everything. We're limited as human beings. We can't make these judgment calls. All we can say is that if we apply this, you know, conservative sort of like treatment, you can expect to get better. Or it is a therapy-based medicine. It takes some time. But, you know, if you want immediate relief and you think of surgery, think about all the PT you have to do after that, right?
Right, absolutely.
And the recovery, that's time lost too.
No, absolutely. There's one thing too, when you're going through the metric, like tenderness and like burning, I noticed there's another question you said, like, if it responds to Advil, like whether it responds to.
So, that's the other one, right? Everybody's inflamed. I'm surprised we're not spontaneously combusting. It's like it's like a buzzword. It's white noise. Oh, I'm inflamed. It's an excuse to sell products. But yes, we all have inflammation. But if your pain doesn't respond well to over-the-counter NSAIDs like Tylenol and aspirin, then the root cause is not inflammation.
Yeah.
And then I'll ask, does it respond well to muscle relaxers? And you could say yes, but it puts me to sleep. Then we know we're looking at a muscular issue. And inflammation is only one piece of the puzzle. The herniation is one piece of the puzzle. A lot of it is the musculature, and there's a whole industry behind it to prevent, you know, long-term harm from low back pain. Things like OSHA and stretching is part of the treatment.
Yeah, absolutely. So like, where do you find this problem the most, where people are concerned about the look rather than, because I realize for shoulders,
Well,
people tend to like, they don't have that same kind of manifestation on, like, you know, they won't tell you like beforehand, like, it's my stenosis, it's my back. People with shoulders tend to be more gung-ho, except it's muscular.
It depends on what insurance covers, what you're allowed. Like most X-rays, they're not going to do an MRI on the knee. They'll do an X-ray first because it's, you know, the insurance will pay for it. That's where you get the bone on bone. With the back pain, you know, depending on what the carrier decides to do, most people will come with, it's gotten to the point where now you have to kind of legitimize the surgery. So you need the proof in the pudding, you need to scan it, do the read on the report and find that there is some sort of herniation there in order to get the surgery to be done. So people come with that stuff already in hand. It's been done, it's part of the paradigm, right? You do conservative care, you fail. You do, next step up is pain management. You do the pain management. The pain management is really just numbing it. It's not correcting it.
Right.
So it's temporary, hit or miss. Some people do okay, some people don't. But then it comes back because you're only blocking the pain signal and you haven't corrected the adjacent accessory musculature. And then that fails, you get pushed up to surgery. In order to legitimize the surgery, you have to show that there's a reason for it, which is the MRI. So people come with it, oh, you haven't. It's like just the same thing. Oh, it comes from your back, it comes from your back, it comes from your back. Yes, but what part? Is it the muscles? Is it this? Is it that? What? There's no good way of finding it. There's no diagnostic method to say you have muscle spasm.
Right.
You know, and maybe there's no money in it.
Yeah, but it's interesting because if you look at it from a pure time perspective, it actually makes more sense for them to come to us first, because for them to even get that picture, they have to spend 4 weeks at PT, where they could just come with us and spend only 20 minutes, not 4 weeks of 2 hours doing exercises. Right?
Yes.
It's like, if you think about it, even if somebody says, like, argues that they're more effective, I'm not even saying they are, but even if someone wants to make that argument, like, the time value, like what, you take a nap for 25 minutes and your back feels better versus going and essentially being put in a boot camp for like an hour and a half.
Healing happens in the room, right? It's your time, it's quiet time, it's really 20 minutes. What have you got to lose?
Yeah.
besides 20 minutes of time.
And can you just remind people like why that relaxation is so important for acupuncture sessions? Like,
So one of the mechanisms of relief is we store the memory of the pain in our back, and when we're constantly running, we are just kind of like overwhelmed by it. So when we treat in the treatment room, what we're doing is we're kind of modulating how you perceive that memory in the brain. We're kind of scrambling that stored memory of your back pain. So the quiet is important, but also the release of endorphins also further relieves pain. So the two together centrally in the brain. That's why we don't call them needles, we call them filaments, because that primitive memory is stored in your brain of when your pediatrician stabbed you. So you're storing the memory of your back pain along with the imaging of the herniation, and it's kind of making things worse on top of like not taking the time to actually take care of it.
yeah, you're getting a firmer anchor to stay.
Yes.
Yeah.
Anyway, I think that's good for this week. Let's tune in next week and we'll see where we get. But reach out and give us a call.
July 20th, Edison, Council Kids Quintet.